I am really excited about today's live session with everyone. If you're joining us, please, if you have questions, concerns, comments about COVID, put them in the chat. We have received a whole host of questions. We're going to try to get to as many as we can. But before I get to this, do want to make everyone aware that earlier this week, we at the City of Rockford partnered with Rockford Mass Transit District, and we are now allowing, starting January 3rd, every student, K through 12, and every veteran to drive our public transportation system here in Rockford free of charge. We certainly owe a great deal to those veterans who have given so much to our community and country, and a free ride is literally the least we can do. And to those students, we really need to be a community that supports and cultivates education. So we want to make sure any student doesn't lack transportation around our community. So again, students and veterans will ride free on the buses starting January 3rd. And if I don't get the opportunity at the end of this live session, I simply want to just say I hope everyone has a happy holiday and a Merry Christmas and finds time to safely spend it with your family. But on to the topic of today. So COVID-19, lots is taking place, and we are incredibly fortunate to have the Vice President and Chief Medical Officer of OSF, and that's Dr. Stephen Bartlett. And I've had the opportunity to get to know Dr. Bartlett a fair bit over the last several years, probably fortunately and unfortunately. Fortunately, I got to know him, but unfortunately, it's been around COVID-19, which I think everyone wants to put behind us. So, Dr. Bartlett, I guess just to start, last week, we talked to Swedish American and talked to them about their capacity, specifically in the ICU. Do you know if OSF is experiencing the similar rise that Swedes has with hospitalizations?
Yeah, we have. I think all three hospitals in Rockford have had the same experience where the number of COVID cases has had an increase since the end of November and most of December. Despite that increase, we've been able to handle it very well. Because of last year's surge, we've been, gotten very good at flexing up the number of COVID positive beds, and we've been able to just stay right with the surge. Fortunately, it so far has not gotten as extensive at St. Anthony's as it did last year. We're at about half to 2/3 of the surge we saw last year. So we're well prepared, and right now we're coping very well.
That's good to hear that you and your teams are coping well with the surge that we're experiencing now. So I guess just going directly at this, with the patients that are being hospitalized, if that's in just a regular COVID wing or if it's in the ICU, those that are being hospitalized, what's the makeup of those patients? Are they vaccinated? Are they unvaccinated? What do you know about that makeup that we all can learn from?
So the vast majority of the patients who are hospitalized are unvaccinated, and the proportion is even greater for the ICU patients. It's very, very rare to see a vaccinated person end up in an intensive care unit. The vaccine is extraordinarily effective at reducing the severity of the disease. Similar to the flu vaccine, it doesn't absolutely prevent the infection, but it does an extremely good job of reducing the severity, so that it is unusual for a vaccinated person to end up in the hospital. And those that do tend to have a milder clinical course and not end up in an intensive care unit. So to give you the short answer, the vast majority of the people who are admitted to the hospital are unvaccinated.
Good to hear. And so just as a lay person, the way I see it is no one ever said that the vaccine will stop, you from getting sick. What it'll do is reduce those symptoms and the severity of those symptoms and have an incredibly high likelihood of not bringing you to the hospital. Is that fair to say?
Yeah, that is fair to say. It will not only reduce the severity, but shorten the length of the illness so that it's less time that you're ill and less time that you're able to spread it to another individual. So the vaccine has been extraordinarily successful. And after 1 billion doses worldwide, we have pretty good information that the vaccine is safe and it's effective.
Good to know. So, it seems like we keep hearing of new variants and strains of this virus. Can you talk to me a little bit and maybe educate myself and some watchers here about the new variant, Omicron, but also how does that compare or differentiate itself between Delta?
So the Omicron variant is quite a very different variant from Delta, in that there are 50 different amino acid substitutions in the virus itself, 30 of them in the spike protein. And it's different enough that it has characteristics that are different from Delta. One, it seems to have a milder illness. It's not as severe as Delta. But two, it's more infectious. It's spreading faster. And because it's more efficient in spread, it's replacing the Delta in every country where it's been found, including the United States. And probably in the next 2 to 3 weeks, Omicron will be the dominant variant in the US, if it's not already now. Fortunately, it's a bit milder, but not as much so in people who aren't vaccinated. It still is creating some severe disease in the unvaccinated. The vaccinated people seem to be doing quite well with Omicron.
Okay, so I guess one thing that I'll just say I'm personally concerned about is I too have read quite a bit that, the Omicron can be milder. Is there some concern that health professionals such as yourself have that, I guess I'll rephrase that. I have some concern that people may say, okay, well, it's milder. I don't have to worry about it as much. I didn't get Delta. If I get this, it's supposed to be milder. I'm not going to be as concerned. I guess, do you agree with people kind of tamping down their level of concern? Or what do you say to those folks who are saying, well, the Omicron's not that deadly and symptoms are milder? What do you say to those folks?
Well, I would say don't let your guard down. We need to continue to use common sense, wearing masks in public. And for goodness sakes, people need to get the vaccine. The vaccine is proven to be effective. And for those who have had the vaccine, we strongly recommend getting the booster to keep your antibody levels high so that you're protected at all times. I don't think there's any place right now to let our guard down. We know that as long as this virus is in the community, we're going to continue to see other variants appear with time. The source of variants is just that for those people who are immune compromised, there is going to be long-lasting virus in their circulation, and those are the people that are where that mutation can occur and the next one come along. Many of the variants that have appeared have not been a problem, but Omicron was one where we've got a very infectious strain, and it's spreading very quickly and replacing Delta. So we can't let our guard down. We have to continue to use the common sense, hand washing, masks, and of course, get the vaccine.
Absolutely. And just for those who have joined us, we have Dr. Stephen Bartlett, who is the Vice President and Chief Medical Officer at OSF, joining us today talking about COVID-19. So, Dr. Bartlett, you mentioned antibodies. A lot of discussion right now across the country, across the globe, truthfully, but also right here in Winnebago County about monoclonal antibodies. So, talk to me at a level that folks like me can understand it, who don't have a medical degree. What is this treatment? How long has it been around?
Yeah, I can make it easy. The monoclonal antibody is what we would call passive immunization. We've been talking a lot about the vaccine, which causes you to make an antibody that prevents the virus from taking hold. Well, if you've been exposed to the virus, and you can get a boost of this antibody the monoclonal antibody, we can give it to somebody, and that can assist with fighting the infection. So it's just really an antibody that binds the virus so the virus can't get into your cells, can't continue the infectious process. So it's just something that literally comes and chomps onto the virus, binds it, and keeps it from getting into your cells. In terms of the availability of the monoclonal antibody, there are two ways you can get it: through your local hospital, and St. Anthony Medical Center does have an outpatient clinic at Rock Cut where we have the monoclonal antibody available. I want to acknowledge that our supply so far is limited, but we're able to give doses there. And for those people who cannot get an appointment in Rock Cut because of supply, we are making appointments for the patient with the Winnebago County Health Department. And so all we need is for the patient to ask, and we'll take it from there in terms of getting them an appointment to get the monoclonal antibody injection. It's given just under the skin. It doesn't require starting an IV. And it is appears to be a very safe treatment for those people who are either high risk or the ones that have an early active infection. And it works in both scenarios. And we are encouraging people to pay attention to whether they fit into those high-risk groups, that the Regeneron and antibody can be useful.
All right. So I guess two questions with that, and I apologize if they're naive. One of these is mine. Can you walk me through, Tom gets in contact with someone who has COVID. I go and get tested at Sandy Hollow site. I'm positive. What do I do to know? Should I get antibodies? How do I do that? What's that process? Do I just call my doctor? What is that process?
Yeah, this most straightforward way is to talk to your doctor, and time is important. The sooner it's administered, the better it's going to work in fighting the virus. But there are particular risk groups where we know that the monoclonal antibody makes the most sense. People who are over 65, people with other illnesses, respiratory diseases, cardiac diseases, diabetics, who would particularly benefit from intervening on the infection very early. So it's the same risk factors for people who end up with complicated COVID infection are the ones where we want to try to get that antibody administered as soon as possible after an infection is identified, or as soon as possible after you've been exposed. So you say you tested positive, but if you have somebody in your household who has active COVID and you're in that risk group, you can get that monoclonal antibody to prevent the infection from ever starting.
Good to know. And I think a lot of us woke up this morning and we're doing quite a bit of reading about a potential pill that has been approved. Can you talk to us about this? Is this real that there may be a pill that we can take?
Yeah, this is another amazing development, that there's an antiviral pill, Paxlovid, that works quite well at reducing the chances of an infection that will end up in the hospital. So it may not make the infection go away, but it's going to blunt the infection and make the infection much less likely to become more serious. And again, I want to liken this pill to the pill we can use for flu, Tamiflu. A lot of people think Tamiflu is something you stir into a glass of water and you stop coughing, but in fact, it's a potent antiviral. Well, now we have a potent antiviral drug against COVID, and these pills absolutely work, and that's going to be another bullet in the gun that we can use against COVID.
Are they accessible in our community? When will they be? Do you have any idea?
I know that the FDA just provided emergency approval. I think it was yesterday or the day before. So we'll see this treatment available in our community fairly soon, I would say in the next few days.
Okay. One question we have received, or a statement that has been made, is, don't listen to the hospitals. They actually want you to get sick because they make money off COVID. So can you talk to us or talk to those folks who have that concern?
That's I could understand why people might have those feelings that the health industry is somehow benefiting from the COVID pandemic. That's not the case. Hospitals right now are struggling financially because of the COVID pandemic. And I think that they're doing everything in their power to maintain all their services, yet take care of the excess number of patients who have infections. Are we profiting in some way from this pandemic? No, we're not. But I have to say, all three hospitals in the city have done a great job of stepping up to the plate and doing what they have to do to make sure we provide service to the people of Winnebago County and not leave them, in the lurch when it comes to the pandemic or for all their other health issues that they have. I think the hospitals have done a great job in this county.
They absolutely have. All three have. I mean, the staffs at all three working overtime and just caring for so many people amongst all the regular illnesses that also come forward and the injuries and traumas that come forward. Just remarkable what the staffs are doing.
Yeah, and the CEOs, the chief medical officers of the three hospitals are talking all the time, and they've worked together. This is not about competition. This is about working together to take care of the problem. The cooperation has been extraordinary, and the health department's been extraordinary in fostering that collaboration between the three hospitals.
Yeah, and just to underscore that, I 100% agree. And I think until people realize that and see what that means and how everyone's working together, huge credit to Winnebago County Health Department, Dr. Martell, huge credit to yourself and all the chief medical officers and CEOs. I mean, they're on a call at a minimum every single week and oftentimes multiple times per week, who are really on the front lines, organizing, coordinating policies, procedures, and strategies to fight this back. So diving a little bit into this, how important is this vaccine to getting us, quote unquote, back to normal, whatever that may look like?
Look, it's extremely important. And I understand that there are folks who long ago made the decision not to get the vaccine. And I think this is a great opportunity for everybody to take a step back and re-examine that decision to not get the vaccine. We know the vaccine is extraordinarily effective, and it has an enormous role in reducing the number of people in the community who are carrying the virus and have the chance to spread it to the next person. So I would urge everybody to take that long-held feeling about the vaccine, a decision they might have made a year ago, and re-examine that decision and go get the vaccine. It's extraordinarily effective. The side effects are minimal, and it works.
So to help them re-examine that concept and thought process, what are some of those misconceptions that you're hearing that you would like to dispel or provide factual information on?
Some of the misconceptions center around government control, and that this has been something that the government has foisted on us for the profit of the pharmaceutical companies. Not true. That there are side effects that haven't been revealed. Not true. I would say that people should really understand that there are now so many vaccine deniers, so to speak, who have ended up hospitalized and who will say in the intensive care unit, I wish I'd have gotten the vaccine. And if we could just keep playing those statements, that people who wish they'd gotten the vaccine, because when you're in the foxhole, you become a believer. That's the statement people make. And I've seen that firsthand of people will say, I wish I'd gotten the vaccine when they're lying in the ICU. So I would encourage everybody to use that sentiment to re-examine their own decisions, because those people who are fatalistic and say, well, I've had it, or, I can't really control what happens. I would say you can. get the vaccine. It's cost-free. It takes 5 minutes, and it doesn't hurt.
And my arm is not magnetized to anything. I've gotten the booster. It still feels just fine. I would also say there's folks who say that, it's a way for the government to track you. My funniest thing is that they say that while they're holding their iPhone. And I'm like, if anyone's going to track you, your iPhone may help a little bit more with that.
Yeah, I've heard that there's a microchip in the vaccine. I'm not sure what the microchip would do or how. That's one of the most amusing canards that's out there. I'm not sure where that comes from, but there's sources of disinformation on the web about almost any topic, but that one is among the most comical.
Yeah, there's a lot of funny ones. So a question that we get a lot is about this natural immunity and that you don't need the vaccine. Do you have any thoughts towards that?
Right. There isn't really any evidence that there is a subpopulation in this country that has natural immunity against COVID. I would say what people are calling natural immunity is luck, and they haven't gotten it yet. I would say that the only way you can be sure of augmenting your immunity is to get the vaccine. But no, there isn't really any evidence of a group of people who just never get the infection. And I think that would be obvious at this point, that there is some substrata of people who don't get it. We just haven't seen that.
Thank you. So one thing that's really frustrating to me, and I'm guessing frustrating to you and all the staff of the hospitals, is our incredibly low vaccination rate. And also, right now we're one of the counties leading the state as well as the country in COVID cases. And we have an incredibly low vaccination rate. I want to say it's 54, maybe 55%, when other cities much larger than us are at 75 and even above. What do you think is leading to that low vaccination rate?
Well, the low vaccination rate, I think, relates to the fact that we're in a community of people who come from a background where they're fiercely independent. And that, look, this country was founded on principles of independence of thought and freedom to do what you want. And I think that's the politicized aspect of the vaccine now has caused some people to say, I'm not getting the vaccine because the government is asking me to do it, and I don't do what I'm told when the government is asking me to do it. In this case, I would try to depoliticize the whole vaccine story and to really just look at this as the combating an infectious disease. People never politicized the polio vaccine. They saw the horrible things that it caused people. And I'm just barely old enough to remember a few people who got polio. There weren't people blocking that back in the 1950s and 60s. But unfortunately, this one has become politicized. And in particular, in Winnebago County, yes, our vaccination rate is a wee bit under 55%. And if we can get up into the 70s, the chances are the pandemic will wither away in our area. And, we're going to be much better off in terms of the experiences our families and kids have. Because when the pandemic gets severe, it really gets in the way of everything that we want to do and the freedoms we have to go to school, to go to church, to, and participate in things we want to participate in. So I would say, yes, get the vaccine, re-examine your objection to it, because it is extraordinarily effective. And I'm amazed at how the greatness of this country that they were going to come up with a vaccine so quickly, and a vaccine that's so effective and so few side effects. It is truly amazing.
Thank you. A couple more questions. So one question that's recently come in is, if you have insurance, if you are fortunate to have a primary care provider, you have a lot of access to professionals with expert advice, folks like yourself who have studied, spent their entire lives focused on this. If you are not, you actually have tremendous access to a bunch of what I would call cousin Vinnies who think they may have went to medical school, and they went to like a Facebook medical school. What access or what opportunities do those who are uninsured, who may not have a PCP, what do you recommend to them so that they can talk to someone and get their concerns answered?
Yeah, that's a great question. And the three hospital systems have a chat line. I know LSF Healthcare does have a chat line where people can talk or text their COVID questions. And that's been an active website for a couple of years now. And that is a great source of information. And I'd also ask people to look at the CDC website. They have very straightforward, easy to read information about the COVID infection. But I appreciate you calling out the Facebook MD, because there are so many people that are willing to provide misinformation on the web that it's hard to know who to believe. And so I do offer some sympathy for people who would be making the wrong decision about the vaccine, because there has been stuff they've read on the web that is steering them in the wrong direction. All I can say is I would encourage people to get to the right source: hospital websites, the hospital chat lines, and then the official, Winnebago County website, as well as CDC. There are sources of good information that can get people to move in the right direction.
Absolutely. So a couple of quicker questions here for you. Can you mix and match different brands of vaccine with a booster?
You can. And I know that the CDC has recommended getting a booster, and don't wait to get the exact same booster of the shot you got before. So my own wife started out with the Pfizer, and she got the Moderna booster. My son got the Moderna originally, and he got the Pfizer booster. So it doesn't matter which one you get, but for goodness sakes, get boosted, because it really works. And the data on that is very strong, that the booster ups your antibody level and protects you.
Thank you. I too mix and match. I had Pfizer, my initial shots, and then Moderna booster. So can pregnant women get vaccinated?
Yes, they can. And we do recommend they do that. There's abundant evidence now that it won't harm the baby to come. And it does, COVID infection in pregnancy can create important complications. And, without scaring anybody, I would encourage women who have not had the vaccine, who are expecting to get the vaccine.
Wonderful. Thank you. Switching gears a little bit to long COVID. We've heard the term long COVID. What does that mean? Are we seeing that have effects here locally?
Long COVID really refers to the side effects of the infection that's now passed. It doesn't mean that the virus is actually hanging around past 10 days. It means the impact of the infection can last, in some people, many months. For those people, particularly who've experienced a more severe infection, they can have brain fog for a long time afterwards, fatigue that is long-lasting, shortness of breath that's long-lasting. Rarely they'll have neurologic changes that can affect them for many months afterwards. So like any severe illness, sometimes there are lagging effects that will go on for a long time. It doesn't mean the virus is still there in your body. It means that the damage that was done continues to have some impact on people. Yes, it's true there are rare people that have long-term infections, like bone marrow transplant recipients, people with immunocompromise from HIV infection. But most of long COVID is related to a non-infectious sequelae of the infection. And unfortunately, it's more common than we think. Another reason why you should get the vaccine.
Okay, so let's say you got vaccinated. You unfortunately are one of those breakthrough cases, so you get COVID. Does that reduce your likelihood of getting long COVID?
It does, because long COVID really relates to the fact of the more severely infected patients who, those who've had an ICU stay, and there's a level of debility that is developed around the infection that has going to have some long-lasting effects. Getting vaccinated will make you less likely to get a severe infection, in turn making you less likely to get long COVID.
Okay, last two questions for you. I know I told you 30 minutes and we're just over that, so two more questions. And I'm really curious about one part of this first question. What do you tell your friends and your family who may have concerns about getting vaccinated? But the part I'm most curious about, because there are some, not many, but what do you tell colleagues who work in the medical field about getting vaccinated?
Well, let me start with colleagues in the medical field. St. Anthony Medical Center, did two things. One, they made all employees have mandatory to get the vaccine. But for those physicians and providers at St. Anthony Medical Center who are not employed, we made it a medical staff bylaw that all members of the medical staff are required to be vaccinated. So we didn't leave it up to person-to-person discussion. We just made it mandatory. And we have virtually 100% of the MDs at St. Anthony Medical Center are vaccinated. There were, I believe, 2 waivers that were related to medical conditions having nothing to do with, vaccine objection. And so in terms of what do I tell, other colleagues and people I know in the community, I take a very no-nonsense approach to it. I don't really broach the vaccine deniers. I just tell them, look, you're wrong, and that you need to get vaccinated. I've said this before, that this country is founded on free speech. People can say pretty much what they want to say, including say things that are wrong. And so people who are saying we shouldn't get the vaccine, they have the right to be wrong, but that's what they are, is wrong. And I would encourage people to get the vaccine. And I tell people very bluntly that not getting the vaccine is putting themselves and others at risk. We're not alone in this. And it's not just your own personal decision. You're making a decision that affects other people. There's many things about our civil rights in this country people pay attention to, but it doesn't extend to, the famous other one to home statement. It doesn't include the right to yell fire in a crowded theater when there's no fire. Well, I would extend that to say I'm not getting the vaccine and other people shouldn't get the vaccine. I don't think people should be saying that kind of thing because they really are uninformed. So yes, I'm pretty blunt with people about the vaccine. We should all be getting it. And I'm not broaching excuses.
Thank you. Last question I have for you, and then I'll close it with any thoughts that you want to leave us with is, if you're vaccinated, you're in good health, you wear a mask. There's also a lot of, a lot of talk, I would say, not information, a lot of talk out there that the booster is really just a way for big pharma to make more money. What's the importance of that booster, even if you're, let's say, Tom McNamara, a fairly healthy person, I'm vaccinated and I wear a face covering, a mask when I'm around folks?
Well, it's certainly not about the money. It's about the science. And the science is that there's strong data that the antibody levels start to wane after 6 months, and even less after 4 or 5 months, the antibody levels start to wane. The booster simply shoots those antibody levels back up. It's just common sense. It gives you more defense. But this has nothing to do with profit for the pharmaceutical companies or government control or anything else. This is just common sense public health.
Thank you. And Dr. Bartlett, I know this is an incredibly family time for you, and I appreciate you taking time away from your family to talk to us about this important topic. Anything you want to close and leave us with?
I would say this, and not playing to your position, Mayor, but you've done a fantastic job with the COVID pandemic. You've been no nonsense yourself. You've been very present. The health department is one of the best health departments I've ever worked with, and I've worked in other cities. We're lucky that we have such a strong health department. So kudos to the city of Rockford. Hey, you've done a great job.
Well, I appreciate you and your entire team. Absolutely remarkable. And again, I know this is actually you're off today with family, so deep appreciation for you for taking this time. And a big thank you to all those who listened. If you didn't have a chance, you're just catching us right now, you can certainly rewatch this on the City of Rockford's Facebook page. Hope everyone has a happy holiday and a Merry Christmas. Please be safe. Do some very basic things to keep you and your family safe. Wear that face covering. Make sure that if you're feeling sick, you're not going out. If you're feeling sick, don't go over to your family's house for dinner. Get tested. Make sure you get vaccinated. It's safe. It's affordable. It takes less than 5 minutes. Hope you all have a Merry Christmas. Thank you.
Merry Christmas.